what our parents gives us the genes, and they give us the physical appearance, and to a great extent some personality characteristics are governed by those. But the nature factor is also very important. You will see nature factor is also very important, and you will find that the environment, the family, the religion, the social setup, the surroundings, everything contributes to give us a total personality and how we are going to operate when we grow up. So this part we need to keep in mind when we discuss. So friends, we adopt certain traits by virtue of the spot or slot we are positioned in the family. Like, I would like to remind you that if you are a firstborn or secondborn or thirdborn or fourthborn in the family, nowadays we have only two children, the firstborn and secondborn. But previously, last generation, they used to have a lot of kids in the family. So their position was very important to give them certain, you can say, personality characteristics. And for that, I would like to remind you, if you try to recall our in the religious field, if you try to remind the Ramchandra and Lakshman, they have different traits. The Ram has the only two dimensions, black and white dimensions. And the Lakshman has got multi dimensions. He is more of a person who can take opportunity to create problems. Similarly, there are two persons, like we have Krishna and his elder brother Balram. So Balram is also having the two dimensions of personality, and Krishna has got multi-dimensional personality trait. So these are because of their positioning in the family. So our behavior pattern is somehow governed by the environment, our personality greatly governed by the environment what we grow into. However, the information given here is to help you to your general information and evaluation. What I am talking is, there are certain evidences for that, and there are many other factors which people try to negate about this information what I am going to give you. And so I am slightly cautious about it, and I would like to suggest that my information given here is having a considerable value, but then you will use your discrimination at your own end to have a final conclusion. So let us go for effect of an absent father on a child. Very typical situation, a child who is growing without father. So what are the things which take place for this child? We are going to have some idea about it. In the first place, I would like to remind you that the child may lose father through death, or maybe with separation of parents, like divorce, employment, like the father is working in the armed forces and he is out on the active services, or his own institutionalization, maybe he has certain problems and he has been admitted in some asylum, or he is in prison. There could be many reasons for that. The most important thing is, what are the effects because of his absence? So it entirely depends on the age of the child. The children are more prone to psychological effect between 1 to 5 years of age, 1 to 5 years of age. And kind of absence, we find that temporary separation from father causes much less suffering. And type of family is, if the children are present in the joint family, they are going to suffer less. And then comes social support. In the event of death of the father, the child gets more sympathy, more symptoms. Uh, more sympathy than when the mother has been divorced. Child will have a kind of a better reception in the society if the father is died, and if the child is separated because of divorce, then the child will get a very, very different kind of attitude from the society and family members. Second comes the socioeconomic status of the family. And here we find that economically stable status with an intact home is less damaging to the child. When their financial resources are enough, and the child and the parents, or you can say the mother, along whom with the child is residing, if she is managing herself in an independent manner, these are less damaging to the child. Then comes the mother's physical and mental health. If the mother is having some sort of a physical illness or mental illness, then it endangers the development of the child. It further endangers because there is no one to look after him that nicely as the mother is been doing, and nobody can take the mother's place. And then we have the problems. What a child can face the problem because of this kind of a absent father. These children are prone to following behavior problems, that is developmental retardation. So there is milestones. Milestones, it can be physical and mental development. Both can be affected. There can be conduct disorder and sleep disorder. The child may not sleep well, or he will have nightmares. He can have disturbed sleep. Conduct, his behavior problem with the family, with the friends, in school, with adult to child relationship. So you will have lot of difficulty in a kind of behavior pattern because child has got no model to learn in the family how to behave with elders, because father is one who is going to teach him the certain rules and regulations and how he should behave with others. And that particular part maybe mother is going to teach, but there is some flaw in the teaching of the mother, because they take mother as a very soft person, and they may have personality problems. Personality problems like we have bedwetting. They can eat less and they can eat more. Sometimes there is a bulimia, or there can be anorexia nervosa in children, especially in girls. Depression is very, very important. And then behavior problem, we have antisocial behavior. Kids, they can fall for drug addiction. So these are the general features what you are going to see. And not only in the childhood, but the shadows are there throughout their life. Even they grow up and they get married, they will have marital disharmony because they do not have any idea how the parents are going to act and react in different situations, because they have not seen any healthy interaction between the mother and father. So they have no imagination, and then they don't have anything to fall back on their memory, on their learning, subconscious learning. So marital difficulties is one of the very, very important things. So these are the, broadly speaking, the major problems. But we would like to see what happens if it is a male child and what happens if it is a female child. On both the things, both the children will have a very kind of a different kind of effect. So let us see that. What will happen to a female child? You will see a female child will suffer more and she will have lack of self-esteem, self-confidence, and a sense of security is less in such kids. Second, they have altered perception of the male. They have not seen the father. They don't have any idea about the males. They don't have any primitive idea about the fathers. So the males, they have their personal view, whatever they have learned on their own or their imagination is there. And then they will find difficulty in forming lasting relationship, especially with opposite sex. And sometimes you will find that the female child, especially female child, is desperate for male attention. And one thing very, very strange is here that these girls, they become sexually active at an early age. And they are prone to sexual promiscuous behavior. That is the most important thing which we need to keep in mind. And more likely, they will not be able to study for a long time in school and they will be leaving the school. Hardly they will be able to pass the matric, or you can say rarely they will reach to the college. And they will have additional other behavior problems, like say for example, they will be suffering from depression and there will be a suicidal ideation. Very usually they will think about suicide 10 times. And then teenage mom, early pregnancy can be a very catastrophic effect. And sometimes these children, they run away and they fall in hands of the unethical people, or you can say the people who use them, and they ultimately land up in the business of prostitution. And the classical effect of a absent father on male child, what happens in a male child? Generally, if they are not properly supervised, they involve in the drug and alcohol abuse. They don't study, they drop out of the school, and they have behavioral problems, especially males involved in crime, drug and alcohol abuse, they commit rape and criminal activities. And ultimately, they will end up in prison. However, apart from above, if the child can resolve the grief of loss of father with adequate psychological support in a combined family, there are grandfather, grandmother, chacha, chachi. So everybody look after such child and they may be able to learn the good behavior pattern. They will become much more mature because they have seen the world in a very different way. So he may develop extraordinary talent and creative kind of a personality, and he will be a successful person. It is not all negative or gloom for such fatherless child, but these are the possibilities which we have seen already. And then most important issue is how mother is expandable in such given situations. How much the strong character she bears, and she has the capacity to keep the home intact, and emotionally she is stable, and financially she has got good resources. Then you will find that how she socializes and maintains her self-respect may be a kind of a ideal mother to the child, and where these children may learn many things from the mother, and in spite of many psychological hazards, they will grow up as a very good person or a very fruitful person in their future life. Somehow, to help such children, in emotional backdrop, they have some emotional problem and you would like to help them, and if you come across a child, so we have picked up few important rubrics. Adolescent child which comes with drugs, desires, psychotropic drugs, puberty in precocity of children, and then we have attempt to run away to suicidal disposition or thoughts, sadness, suicidal disposition with love, perversity, sexual, mind, antisocial. Eighth is the drug desire, psychotropic. Ninth is mild alcoholism. 10th is mild alcoholism, grief after, and 11th is mild ailments from death of loved ones. These are some of the rubrics which came to my mind, so I have kept them here, and we have repertorized it from uh, his radar, and we find there are some important remedies. We have taken almost 10 remedies, but we understand the aurum metallicum, medorinum, nux vomica, lecasis, ignatia, staphyls, aconite, hyoscyamus, murk, and natrum sulph. These are some of the important remedies which come across this repertorial analysis, and I feel at some stage you will find some of the remedies extremely useful in cases where there are emotional turmoil, to help the child to gain emotional composure. So it finishes with the fatherless child. Now, the next topic we would like to see is the effect of maternal deprivation on child. What happens if the mother is not there? So, my friends, what happens? We know that a human infant is most helpless creature and requires a very long period of time, maybe 10, 15 years, which is a very dependent years of life, and they majoritarily are looked after by mother only in the house up to the 5 to 6 years, till the time child goes formally to the school, is entirely dependent on the mother. And thereafter, after 6 years or 7 years, he comes in contact with the father. Therefore, the motherless child is at a great risk. And what are the factors where we find mother's absence? Are death of mother and separation from mother due to either divorce or due to adaptation, or working mother. Commonly nowadays we come across working mothers are there. There are factors which will ultimately determine how profound the effect of maternal absence will occur on the child, and what is the degree of separation is very important. And you can understand that the temporary separation is less damaging than a long-term separation. And time of separation is also very, very important. Say, for example, an infant under 6 months of age is able to adjust to a new caretaker with ease. If the mother is being replaced before the 6 months of age, the child may depend on the next caretaker totally and will have a good bond with that caretaker person. And we see the presence of siblings. If there are elder children are there in the family who have been there, then child who is alone is more prone to suffer personality disturbances. If siblings are not there, children are not there in the family, probably this single child will have a very profound effect, and it will affect his personality tremendously. Another thing which is very important is the nature of substitute nurturing. Who is looking after the child? That is more important. A care of close relative like grandmother or aunt is much less damaging than any other third person looking after. Partial deprivation. Say, for example, the mother is there, but she is going out on job, and there are people who have around the clock duties. Sometimes the mother is out at night. Maybe there are doctors, nurses, and other paramilitary workers. You will find in those cases there is a partial deprivation which will bring about anxiety, guilt, depression, and it will affect the hunger. The child may lose appetite or child may start eating more. There can be bulimia nervosa or there can be anorexia nervosa. Something like this can happen. And the complete deprivation is it progressively deteriorates the child's development into complete withdrawal, refusal to eat, weight loss, and even death can take place. So complete deprivation is very, very devastating for a child. So what are the common problems which you will see in case a child is deprived of the mother's care? That is food refusal, child will not eat. And we can understand in turn that he is going to lose weight, he will not pick up the weight. Then social withdrawal is also there. The child will not grow mentally also. There is a mental subnormality. There could be habit disorders like thumb sucking, bedwetting, which shows the insecurity and boredom. There are personality problems also, like inadequate personality. Child can have antisocial behavior. Anxiety is marked. Depression can be marked. And then most important issue in such situation is the addiction. The easiest is the drug addiction. So what we can help the child, how we can help the child. So if we have foster mother, then we are in position to talk to them, and we know some family probably, then our role is that we have to encourage to remain with the child to the caretaker as long as possible, to see the child's emotional needs, or you can say, which is not possible, then one should go for a daycare center where individual attention and situation is being provided to the child. So these are the few things which I have seen in terms of motherless child or absence of mother and that's effect on child. Let us see one more situation here, and that is very, very important situation for children, is a adopted child. And what are the impact of adaptation takes place on a baby, that let us well get converse with this. So adoption is a official transfer of the baby through legal means of all the parental rights that a biological parent has to the child. So instead of biological, ultimately the person who is adopting, he is responsible for all legal purposes. And that it includes care and supervision of the child, its nurturing and training, his physical, emotional health, as well as financial support. Everything is with the person or the family who adopts the child. The majority of the adopted children are born out of wedlock. Whatever we get such children, so they are not from the family itself. And most of the placement occurs before 12 months of age. So what are the factors which are good for successful adaptation, they are when you adopt the child at the earliest age, before 1 year, maybe soon after birth or within 6 months is the best period. And the people who are adopting, they are young parents. And then the child is healthy and adopting parents are also healthy. That is also very, very important. And then foremost important thing is willingness of the both parents as well as other family members for that adaptation. For adoption, it is not only the couple who needs the child favors that particular thought, but then if the grandparents are also in tune with that kind of a thinking, it is a great boon for the child who is going to be adopted in such family. Gradual communication to the child about adaptation, and then what happens that as the child gradually grows, you should be able to give the feedback to so there will be a you should disclose the child about his adaptation, which should be gradual. If you are not going to do it, somebody else is going to do it, and that will have a very derogatory effect on the child. What are the areas in broad terms? It has been found that adopted child has three main areas of potential difficulties. And these potential difficulties is number one, the relation of his adoptive parents to his being adopted, his own reaction to being adopted and affect his separation from his biological parents and placement before going to his adopted home. This situation is when the child is grown up. The outcome of adoption is influenced by the age of the child. Younger the child, better is the adjustment. Next important thing is health of the child and parents, presence of physical or mental illness in children or parents, and willingness of both parents or the grandparents to make the adoption successful. The act of adoption should not be kept secret to other family members or relatives because firstly it will keep the parents in a state of chronic tension that somebody may disclose this fact, and secondly is the child may learn about it from someone else and which has got a very serious reactions. Telling the child about the fact of his adoption should be gradual process of a communication. And the third is the very important fact. Adoption should never be revoked because it endangers the psychological development of the child. And then what happens, you see, it predisposes him to inadequate or antisocial personality, conduct, and emotional disorders, sleep disturbances, and learning problems. The caution. Since the adopted child is the couple's first child, parents tend to be overprotective and over-expecting from the child. That should not be done. Parents also have difficulty in expressing anger at the child. The child may even be resented as evidence of parents' infertility. So there are two components which are very, very important. The parental reactions, and if both the things are negative or they are overt in their child care, or you can say they are overprotective parents, both are going to harm the child tremendously. So let us see what could be the adverse consequences of adoption could take be there. Especially in case of children, you will find inadequate or antisocial personality. The child may develop this kind of a personality. There can be conduct and emotional disturbances. Sleep problems can be there. Behavioral disturbances can be there. And school failures. These are the very, very broad areas where the child may suffer. See, if the child is adopted before the age of 1, the adverse problems are minimum. But if the child is adopted after this age, he develops more behavioral problems, especially in terms of aggressiveness, lying, stealing, cruelty to animal, etc. School difficulties, sexual acting out, etc. The most important issue, the child is adopted when the child is grown up, is adolescent, you can say. And then the problems usually arise as these adults find difficulty to adjust in new environment. And this crucial stage, they actually need more liberal and affectionate attitude of parents and relatives, which will help them, making them freer and more communicable to the new surroundings. If somehow this particular kind of a behavior pattern is not acceptable to the new parents and they treat him just like a small kid, then problem will arise over there. So major problems when the child is adopted in the adulthood is alcoholism, depression, suicidal tendencies, sexual perversions, antisocial behavior. So next thing is, if at all, what are the things which are going to help us to minimize the adverse consequences of adoption? That means to maximize the parental attachment. Adoption should occur in the first few weeks of the child's life to best support of the child's development. The key factor of adoption is if you can adopt the child within soon after the birth, and that is going to help the child and parents both tremendously. Next important problem with children which we find is the child beggar. These are very special circumstances where we find children are there. And according to a conservative estimate, more than 3 lakh children across India are forced to beg, using everything from addiction to drugs to threats of violence and actual beating. These kids are controlled by certain mafia people or their parents or somebody who is profiting out of their begging. They at times use drugs. Certain drugs are given to these kids, or they have been beaten and they have been deformed by such people so they can earn more begging. By and large, in India, it is a multi-billion rupee industry. The Indian National Human Rights Commission reports, please remember, Indian National Human Rights Commission reports that 40,000 children are abducted in India every year, and out of it, over 25% whom remain untraced, means 30,000 children every year remain untraced, and probably they are used in this particular trades by the mafia. Yet, child begging is not addressed by the authorities the way it should be. It is often assumed that these children belong to families who push them into begging. So, we need to understand how these beggar children are abused. These children are regularly inflicted with wounds, even maimed, so that they become more pitiable and therefore draw more alms from a sympathetic passerby on the streets. These kind-hearted men and women often don't know that the money they are giving is not going to go into buying food, medicine, or access to education, but alcohol and drugs, and also given to their traffickers. Then children are abused according to the accounts of rescued children. What they have told, they are given daily targets for their begging trips. Drugs are also used to keep children sedated. It is common to see a woman pretending to be mothers with a sleeping child. The child is usually drugged into submission. You might not have seen any child who is crying in the streets in the mother's lap. They are just sleeping, and they are not sleeping a natural sleep. They are being drugged. Please remember this. It is also not rare to hear the cases where babies are rent from laborer class mothers to make them much more pitiable to passerby. So some of the kids who are being seen with the mothers, they are not their mothers, actual mothers, but they have rented the child for begging purposes. Shockingly, Mumbai police found that many parents in the Mumbai are able to live comfortable lives simply by pushing their children into the begging. That is what the Bombay police tells us, which is very difficult to rely upon now. What things are coming up with the Bombay police, probably you will take this statement with a pinch of salt. And then they do not use the facilities offered by government for the Right to Education Act while forcing their children not to attend the classes. Even when sent to shelters by the Child Welfare Commission, parents would come to the shelter to receive their children and push them back again into the beggary. That is what the Bombay police tells us. Now let us see what is the situation. We people are living in Delhi. What is the situation in Delhi? For a number of child beggars in the city, begging is a part-time job since they also manage to do street vending and rag picking. Please see this. They are having multiple jobs in their hands. So it is a part-time job for them. More than 57% children beggars started this as a in a survey conducted by the Polish Commission, Delhi Commission for Protection of Child Rights. They have told the Delhi Commission of Protection of Child Rights, they have conducted a survey, and in survey we have found out that the Delhi beggar children who are begging, they are not begging, but they are rag picking also and street vending also. So it is one of the part-time job for them. Even as the police hints at the organized racket, this study on such minors reveals a sorry tale as 80% of children were forced into the beggary by their parents. That is a very strange situation for us here. And NGOs, they have pointed out that these people might not be their parents and there is no documentary proof to suggest that. So they can be dubious parents, and probably these kids who are begging these are the kidnapped babies who have never been able to trace by their true parents or biological parents. Children involved in begging told the workers that they were beaten by the police if they begged, and if they are not begging, their parents are going to beat them. So they are in difficult situation. So child beggars in Delhi, let us see what is the distribution. We have 64% boys, 33% girls, and 33% babies in hand. So that is the distribution what we have in Delhi. And district-wise location of Delhi beggars, you will see we have Central Delhi, East Delhi, New Delhi, North Delhi, Northeast Delhi, Northwest Delhi, South Delhi, Southeast, West Delhi, Shahdara, and Southwest. And each has a very different kind of topography. So there are tourist spots, there are streets, residential bastis, religious places, red lights, market, flyovers, bus, train stations. All these are the places where these kids are there. So the different places, how they are there in different regions of Delhi are being given in this graph. Then district-wise distribution of child beggars. You will find approximately normal beggars in central Delhi are 965, handicapped are 16, babies in hand and arms are 16, the total 997 beggars are there in central Delhi. Similarly, in East Delhi, we have 213 beggars. So that is what the documentation has been done after doing survey work, and they published a paper, and from here I have got this particular data. So it can gives us the tip of iceberg. This figure may not be the truthful, maybe there are more beggars than what we see here. The gender and age distribution of sample is there are you can say in age group of 6 to 9 we have males 49 and female 40. In 10 to 12 age group we have 151 males and 80 females. Age group 13 to 15 we have 142 males and 60 females. And age group which is 16 to 18 we have 46 males and 37 females. And that kind of age and sex distribution we will find in child beggars in Delhi. And how they started, when they started begging, is also a very important thing to know about it. The most of the children, 80% children, approximately 60 to 80%, they are begging since birth. And approximately 40% have started by the age of 1 to 5. And 6 to 9 is more than 100, 120%. 120 people started like that in this age group. And 10 to 12, we have 140. So that is how the age and male-female ratio is there. From where these people are coming? Nobody is from Delhi itself. Delhi is full of people who are migrated to Delhi from different states. So the beggars are also, and their families are also. So you will find the maximum child beggars in Delhi, they belong to UP. And then comes the Bihar, followed by Rajasthan, and then people who are residing in Delhi, West Bengal, Punjab, Haryana, Madhya Pradesh, other states, and don't know. So you will find the states from Kerala and south, we have not many beggars here. From Kashmir, we have no beggars. From Himachal Pradesh, we have no beggars. From Uttaranchal, we have no beggars. The biggest belt for begging is UP, Bihar, Rajasthan, West Bengal. Punjab is also there very exceptionally. Haryana is also there. So that is how the things are there. And these kids, if you ask them why they have left home and why they are coming begging, so you will find the migrated families with families are maximum. Then there is a financial crunch. They want to help their family financially, and then there are kids who are abused at home, and there is a parental disharmony, there is a insecurity in the family, so these kids run away and they start begging. They did not like home because of parental death. Some of the kids are there. Some of the kids have been disowned by the parents and they are on the streets, and there are floods and calamities in different part of the nation, and these particular people migrated and they started begging here, recently got married here in Delhi and started begging. They have been lured to the city. Somebody brought them into the city as a child, and that they have been used in begging. And some of the kids have run away from their home and they landed up in Delhi, and they are following since then the profession of begging. So, how these kids are staying in Delhi, that is also very important. So majority of the kids are staying with parents. Second is the relative. Third with friends. Fourth, there are married people, married girls who are also begging and they are living with their spouse. And some of the kids, they are living alone. So that is how the data about the child beggar we find in Delhi. So how you can help these street children? So the best thing is to report to authorities, but they are not going to listen to anybody. So that is not a good option. Volunteer at the Center for Street Children. Yes, you can do. Some NGO can be there. You can approach them and help them and support an NGO in fundraising and other initiative, whatever they are doing, and get involved with these kids. So the conclusion is that now that you know about these, about the nature of organized begging, you may not like to think twice about giving directly to these India's underprivileged child beggars, but you will support some through some NGO. That will be the most logical thing. So, friends, should we go ahead? The next topic which we can cover, child with very, very special situation, is child abuse. So what is child abuse? We can broadly say that child abuse involves words or overt actions that cause harm, not only harm, potential harm or threat of harm to a child. So that is how the broad understanding we have about child abuse. So roughly, broadly speaking, what is child abuse is you abuse a small kid verbally, that is child abuse. You tease a child unnecessarily. You force a child to touch you at places where it is objectionable, and then you create a problem for child. You don't encourage the child doing his studies or doing some remarkable thing, and in that way you break down the self-confidence of the child. That too also a kind of a child abuse we have. Or you expose a child to pornographic acts or literature. You touch the child where the child do not like to be touched. You start hitting or hurting a child, often to relieve your own frustrations, because child is so big that he cannot react. You cannot take out frustration anywhere else, and child is the best thing where you can take out your frustration. And then you start manipulating the child. or not taking care of a child. For example, child is unclean, unclothed, not been properly fed, using child as a labor or a servant at home, and neglecting the emotional needs of a child, love and affection. So these are the things, they are also included in child abuse. Sometimes people make their own child to serve and deprive them with education and leisure time. They are kept busy in household activities all the time. You neglect the child's education, you don't care about it, and leaving the child unattended at home where he can or she can come across fire or some electrical appliances where the child is going to have some sort of injury, and hitting or ridiculing a child at school. At a school also sometimes some of the teachers, they misbehave with the children's and neglect, and at the family sometimes parents, they also neglect the child's medical need. This whole thing, this whole scenario is taken into consideration, and that encompasses the child abuse. So let us go ahead with this, with a proper definition of child abuse now. We have taken just an overview in a layman's terminology, but then let us go ahead specifically. The definition of child abuse is it is a non-accidental physical injury, minimum or fatal, inflicted upon child by persons caring for them. Whosoever is looking after the children, if he is doing something which is not accidental and which involves in physical and emotional injuries, probably you have to understand that all is included in the definition of the child abuse. So what is the prevalence of child abuse in India? India has largest number of children in the world. Approximately 40% of its population belongs to this group. If we have approximately 125 crores, so you will find approximately 45 to 50 crore people fall in this particular age group where they can be grouped as children. 69% of Indian children are victim of physical, emotional, or sexual abuse. That is a very big data. Probably sitting in the OPD, we are looking after so many kids and we have thinking about their emotional and symptoms where they come with the emotional symptoms. We try to find out the cause. We talk to the family. We talk to the school teacher, and we find that nothing helps you out. And probably most often you have to understand what is lying behind that particular barrier is the child abuse. In my professional life, I have seen many kids, and I have seen many people who have abused their child, but then we don't have anything to prove. And at times I have tried my level best to show these kids to the psychologist as well as child specialist as well as a skin specialist, where I find that certain injury marks are not natural injuries. They are inflicted by the caregiver or somebody in the family, but they were also ignorant. But then I was not convinced. Most of the times, whenever I try to explore the areas why this child is having this problem, those parents, those mothers, those elderly ladies who used to accompany these kids, they never came twice to the hospital. Whenever they found that somebody is not happy with their explanation, they will not come to you. So you have to be very sensitive as well as intelligent to decipher the situation, because the data speaks something. We are not very conversant with this data, and data is very strange. Anyway, the prevalence, especially let us talk about the Delhi state. What happens in Delhi? In New Delhi has over 83% abuse rate. We all civilized people, all government servants And all well-to-do people are living in Delhi, and data tells us that there is a 83% abuse rate is here in Delhi. 89% of the crimes are committed by family members. That is also very, very important fact we need to keep in mind. The boys face more abuse, more than 72% than girls, 65%. That is what the ratio tells us, male-female ratio. Males are more the victim of child abuse here. More than 70% of cases go unreported and unheard, even with parent and family. Nobody tells you, even the parents and family ignores if something goes wrong. In the family, they will guard it as a secret, not to tell anybody. Forget about it. Don't tell. Don't speak about it. So, what are the predisposing factors we have? And from point of view of discussion, these can be taken into three main groups. What are the main groups? There are parental factors, there is a child factor, and then there is environmental factor we have. So friends, let us see the parental factor. The parental history of abuse. If parents in their childhood have been abused, they will repeat the same thing with their parents, with their children. So history of parental abuse is very, very important for us. Then people who belong to lower income group, who are poor people, poor household, they top the list. Another dimension to the parental factor is lack of education, and sometimes they are socially isolated. Many people come to Delhi in search of their livelihood, and they do not have anything, their relations or the people from their states where they are residing. So they find totally alienated in that surrounding. Nobody is talking them. They cannot share their cultural things with anybody. So such people who are uneducated and they are socially isolated, these people are those who are going to indulge into child abuse. Then, as we know, single parents, they are under stress. Single parenthood, unmarried girls or divorcee, single parents, they have to look after their occupation, job, both ends. You have to meet your professional, your career, your house, and the kid. It is a very demanding situation where the child gets a raw deal at times. Sometimes mother is not emotionally or psychologically healthy or efficient. They have some emotional or psychological or behavior problems. They cannot function as a normal person to look after a child, but then they are looking after, and in that process, they are abusing the child. Sometimes the parents who are alcoholic or who are dependent on drug, they are prone to misbehave with their kids or create problems with their child. The second important factor what comes here is the child factor, and in child factor we have unwanted or unplanned child. The child is really not welcomed in the family and it becomes a burden to the parents. They psychologically do not accept the child as they should. At times, the number of children, if they have more than three children below the 14 years of age, that is a tremendous stress to the parents. Children's temperament also important. Sometimes some kids are very, very notorious. They are extrovert. They are troubleshooters. like Chamomilla child, small infant, if cries more, definitely unknowingly parent can react in a very, very different way. And if the child is grown up, he can be beaten up by the parent in a spur of a moment of some emotional state when the parent are angry, child is not following toilet training, the parent may get very, very angry and can abuse the child. Position in the family, birth order is very, very important because the first child in the family will get all the raw deals, all the experimentation with the children because the first child is the parents don't have that kind of a experience with child rearing. They will experiment and they are raw. So at times it is quite possible that the first child may get a rough deal, or sometimes the second child will be ignored because they know that children keep on doing such things. So they don't bother about it. So extra liberty is given to the second child most probably. The additional physical need, if ill or disabled, if child is having some problem, physical problem, definitely he requires much more assistance and care, and that drains the parents, and this drained parent may react in a very abnormal manner at times. So friends, the third area is the environmental factors we have. And in environmental factors, what we keep in mind is problems of diverse people, single parent again, and then poverty is the major contributor. Unemployment causes stress, financial stress, and other stresses which ultimately culminate into the short-temperedness, poor housing conditions, frequent relocation. You have to keep on changing your house very frequently because you will not be able to pay the rent, that much rent. Alcoholism and drug addiction is overt behavior patterns which ultimately create problem for kids. So these are the factors which needs to be kept in mind whenever we are looking at the child abuse, any child who has got anything like that. And child abuse, broadly speaking. Now let us come to the truly what are the broad areas of child abuse. We have learned many, many things about child abuse. But please remember, child abuse is number one condition where we have child neglect. Second condition is a physical abuse where we can call it battered child syndrome. Battered child syndrome. And third is shaken baby syndrome. Shaken baby syndrome. And the fourth is the sexual abuse, which is very, very serious. Of course, the battered child and shaken baby syndrome is not less serious than what we understand sexual abuse. So these are the broad groups of sexual abuse or child abuse we will have. So friends, let us go down to the child neglect. With proper child abuse, the first thing which we need to see is what is child neglect. You see, the child neglect is the adverse consequences of inadequate parenting. Biologically, anybody can produce kids, but then you should be emotionally, mentally, economically, should be able to look after the child, but then people are not. They are not mentally, financially, and socially. They don't have that kind of a dimension where they can look after a child, but then biologically they can produce child, they can become mother and father. So what ultimately happens is they will result in carrying out inadequate parenting, and that is what basically happens. And please remember, whenever the neglect is deliberate and severe, when you do willingly and profoundly, the term deprivation is being used. There are two things. One is the neglect, which you do not know because you are non-inefficient, you are inadequate. But then sometimes you are doing it willingly, deliberately, and that too also in a very severest form. Probably then what we are going to use is the deprivation. Child deprivation is the word which we are going to use. Anyway, the following types of neglects are accounted. In child neglect, the following areas are seen. Number one, the physical neglect. The common features of physical neglect include, number one, the children who are under conditions of, say, for example, inadequate food, clothing, and shelter. They are not looked after in terms of their physical needs, food, clothing, and shelter. And child coming to school hungry with no provision of lunch, without lunch box, the child is coming smelling of urine, he has passed urine in clothes, and nobody has changed the clothes, coming in the same clothes. They have dirty feet. So these are the observations probably will guide you about the physical neglect. Second is the nutritional neglect. So what you will see in nutritional neglect, poor hygiene, failure to thrive. We have thin extremities, narrow face, prominent ribs, wasted buttocks. These all features, they point protein calorie malnutrition. To be very frank, the child is coming with malnutrition, and the predisposing factors could be the working parents. They don't have time to look after their kids, and there is a domestic disharmony. Mother and father both are fighting. There is a divorce. There is a financial crunch. Father is alcoholic. Huh? The female child, especially in India, please remember, female child is at the receiving end. Too many children in the family could also be one of the reasons, and you will see all these features commonly in a child who is living in orphanage. The emotional deprivation, the maternal deprivation, you can see is very, very important aspect of physical emotional growth. Both are attached to it, because child will not thrive unless and until you have emotional needs are fulfilled to a child. The classical features seen in a infant raised in orphanage, especially in orphanage, you will find in infants, they are withdrawn, they are listless, immobile. There is an expression of pain and unhappiness, and smiling is difficult to elicit. Growth failure with history of adequate appetite. The child eats well, but still losing flesh. What you see here, not thriving child. He is not sick. He doesn't have any thyroid problem or any other problem which will be responsible for physical ill growth. Sometimes you will come across physical retardation because the child is mentally retarded also. There is a speech and language delay. There can be emotional disturbances like anxiety, phobia, depression. There are habit disorders like the child is thumb sucking, nail biting, bed wetting, eating and sleeping problems, overeating or undereating, sleep, remains awake for a long time. And then if the personality problem, they have antisocial. The grown-up child, if the person is grown up probably, and then you have the personality, antisocial personality, drug abuse, that comes up later on. And fourth is the safety neglect, where we have a situation in the home where if you are not careful, the injury will take place unless you are supervised. The parental supervision is essential in early years, 1 to 3 years of age, as the highest mortality from the accident occurs in this first year of life. There is a hazardous home environment, like you have drugs which are easily available to the child. They can open up the bottle, they can take up the drugs, poisons, caustics, knives, pets, firearms within the reach of the child in certain indications of neglect. It is particularly you are finding it is very, very bad on the part of the caretaker to leave things unattended that way. And then lastly comes the medical negligence in terms of, you will find in acute diseases, parents don't bother to consult the doctor. Unless and until there is an emergency, they will rush to the child to the emergency. And then in chronic life-threatening conditions like we have asthma, we have diabetes, juvenile diabetes, we have emergencies due to the parental neglect, entirely because of the parental neglect. They have not been following the guidelines of the treatment, what have been told to them. And then third is the neglected child care, especially in terms of vaccination and immunization. You are not following the norms. And these are the medical neglect we find in child neglect. Again, the educational neglect. The children are kept at home, maybe because of financial restraints, or sometimes there is a need in the house to look after the siblings and to help the household chores, and at times their parents' emotional needs. There are old people in the house, probably they would like to have the company of the child. Nobody is there to look after them. So what is the management protocol? You need to assess the family, evaluate the type and extent of neglect, and then you have to chalk out a plan how to address the treatment plan for that. The treatment plan is educate the parents to correct their erroneous attitude and behavior. And if the neglect is willful or sadistic, a long-term foster placement is necessary. If it is because of willful, then you have to take help of law. You have to do something so the child could be placed in the rightful place for his care. Friends, uh, Dr. Muktinder is there. Hello, Dr. Geeta. Hello, Dr. Geeta. Should we go ahead? अभी हम चलें और कि यहां पर खत्म करें डिस्कशन लेकर के? डॉक्टर गीता. हेलो. 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 ओके. थैंक यू संजीव. थैंक यू, थैंक यू, थैंक यू. Dr. Khanna sir, good evening. Am I audible and visible?
Yes, sir.
हम चालू रखें, चलने दें अभी फिलहाल, हमारे पास हिम्मत और टाइम है।
Yes, sir,
हेलो,
we can do it, sir.
okay, thank you so much. So we'll go ahead with the second, the child abuse. We have battered child syndrome, okay. So very first time we heard about battered child syndrome was Dr. C. Henry Campe. He wrote a landmark article on July 7th, 1962, long time back, the battered child syndrome. So then thereafter we have learned about the kids who have been badly hit by their parents. He was working at the University of Colorado Medical School in 1962 and trying to understand a seemingly inexplicable pattern of injuries in young children, such as mysterious fractures and convulsions without any known history of trauma. In that hospital emergency, there are kids are coming which are very serious. They have fractures, they have convulsions, and there is no whatsoever good reason to believe how these kids could suffer. At times you can attribute to it to a fall, to viral fever, but then it doesn't happen that way due to fall. That kind of a fracture doesn't take place. He was astonished, and then he started working on this particular kids, and ultimately he wrote a you can say thesis. So battered child syndrome is found at every level of society. It is very common. Every level of society. It may be seen in the poorest of poor and richest of rich. Filthy rich people in their family, you will find this kind of a pattern. That is very astonishing thing is there. Although the incidence may be higher because all the cases are not reported. Some of the cases are reported, some of the cases are not reported. So we do not know the exact how many kids are suffering like this. But then we know that the exact number must be much more than what we come to know in day-to-day cases, or accidentally we come to know something about it. So anyway, so let us see who is the abuser. Who is abusing this child? The child abuser most often injures a child in the heat of anger or during moments of stress. He is under stress already, and child cries, and child doesn't behave normally. He wants the child to pass a stool, and child is not passing a stool. He wants child to piss around in the proper place, and child is not listening to him, or child demanding food at odd hours. So that angers the parent or caregiver, and suddenly in the spur of a moment of anger, he reacts in such a way that the child receives a gross injury. The common triggering events for such acts are: number one, incessant crying. The child keeps on crying, 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 or toddlers failed toilet training. The battered child syndrome refers to non accidental serious injuries sustained by a child as a result of physical abuse, and that too also inflicted by an adult caregiver who is looking after the child. He is the one who is doing all this. Non-accidental, serious injuries to a child because of physical abuse. And who is doing all this? His caregiver, his mother, father. So how they get medical help? And very strange thing about is there is always a delay in the visit to the emergency. And for delay, whatever explanation is being given in is not a valid explanation from your point of view. If you are listening to them, probably you will believe, no, this doesn't look logical at all. And the cause of injury is also not logically what the parents are telling you. Both the things do not meet the criteria. Then what are the symptoms? The symptoms of battered child syndrome, you will find the bruises that match the shape of hand. There can be a print, fingerprints on the cheek. There can be a blow, fist, or the child is hit by a belt. So you will have the absolutely dimension of the breast, that belt is on your back, child's back. There burns, cigarette butt burns, scald marks, bite marks, black eye, lash mark, bruises or choke marks around the neck, and then fractures. All possible results of battered child syndrome include, you can see the slap mark on the cheek. You can see the fist mark on the buttocks. You can see the bruises been hit on the face. This is the black eye. All these things are quite telltale. Look at the child and you know what has been happening to these kids. Bruises, slap marks, strap marks. What are the strap marks? These are 1 to 2 inches wide, rectangular, sharp bordered bruises of various lengths you will come across. And these are the strap marks you will come across in a child. And the object used, you can see what are the object used to hit this child. Burn marks. These are present on the body parts. They can be present at face, arms, torso, buttock, thigh, and legs. And you can make out, looking at the child. See here, the extremities child has been burnt. See at the face, butt marks. See at the face, butt marks. Scalds. What happens? In burning water, in burning bucket, the child is suddenly immersed. And then you will find what happens if the child is immersed like this. There is a water level, and just below the water level, the buttock of the child is going to touch the bottom. Heel is going to touch the bottom. Rest of the part underneath the water is in contact with the water. So these are the immersion burns often result in typical pattern that gives clues to the mechanism of injury. Level of water gives you a demarcation line. Just below that line, you will find all the scald marks. By immersion in scalding water, so these are 3 signs which are very, very important. Forced submersion. So there is a fixed pattern. Level is very, very much there. The zebra strips are there. Wherever the folds are there, there is skin folds. You will find burn is not there. Where the water is not touching at the buttocks, you can see donut hole scalding. So these are the features which are generally seen in cases of immersion in the scald, immersion scald. What are the symptoms you will come across is circle marks around the waist or ankles, unexplained unconsciousness. Child has been beaten so violently that his nervous system is in shock and he is unconscious. Separated sutures and bulging fontanelle in a small infant. The small infant where the sutures are still to be fused together, so there is a dislocation of suture. They are misplaced in position because they have been very violently shaken, their head. Fracture and dislocation. And especially please remember 80% of all fractures from abuse are seen in children under 18 months. Under 18 months, if you come across anything which is a fracture or dislocation, please don't believe anybody. There is a very strong suspicion that the child has been manhandled or abused. 20 to 50% of fractures in children under 1 year of age is definitely resulting from child abuse. And a rib fracture, 7 in 10 is because of, out of 10 cases of rib fracture, 7 cases are because of child abuse. Second version or second type of child abuse is shaken baby syndrome. Shaken baby syndrome. What happens? You see, your head is shaken anteroposteriorly very violently. You pick up the child and shake him. It is an act of violence. And in this type of shaking, it leads to serious brain injuries which can be fatal. Child may not survive, or even if survives, he will have residual central nervous system damage throughout his life. A very big price to be paid. And this is generally triggered from the tension and frustration, usually generated by babies crying or irritation. Just babies crying, and that is enough to behave by an adult who is looking after this child. In shaken baby syndrome, what is this pathophysiology? We have brain. If you shake it, it hits posteriorly and anteriorly, means frontal lobe and occipital lobe. Both are the lobes which are going to hit against the bone, frontal bone and occipital bone, and there will be edema, swelling and bleeding. So there is neural damage. Because of neural damage, swelling is there, and the child is going to cry during this particular phase. And if he holds the breath, or because of central nervous system trauma, suddenly there is a breath holding and child is not been able to breathe because you are holding the chest very tightly, probably inspiration, expiration is not possible. There will be hypoxia. Hypoxia will be affecting the central nervous system. More than 5 minutes, hypoxia, central nervous system is permanently damaged. And because of whatever damage is there, because of the shaking or because of the trauma, there will be swelling. And edema will further cause pressure on the blood vessels. So blood vessel will not be able to supply the blood to the affected part. And again, okay. So raised intracranial pressure, and because of swelling, there is a raised intracranial pressure, there is a reduced perfusion pressure, the blood vessels cannot supply the blood, and there will be resultant ischemia. Resultant ischemia will lead to the cerebral damage, and there is a nervous damage which is extensive and irreparable. Profound nervous damage will be there. So in shaken baby syndrome, the way how the child is been held, the way how child has been shaken, the way how chest has been held, so there will be rib fracture, there will be damage to the central nervous system, and there will be damage to the joint, especially the knee joint. These are the three areas which are very, very important for us to remember. So what kind of injury is this? This is a whiplash. Forces cause subdural hematomas by tearing the cortical bridging veins. Whiplash forces cause subdural hematomas. And you can see the frontal lobe, occipital lobe, and that bleeding is there. Bleeding will take place in the retina also. Brain hemorrhage, it can be subdural and subarachnoid hemorrhage, massive retinal hemorrhage, pre-retina, intraretina or subretinal hemorrhage, brain swelling, raised intracranial tension, long bone injuries are there, bruises and abrasions are there. So what we'll see, immediate symptoms, what you will come across is The unconscious child, there can be vomiting. The child is not crying anymore due to brain damage and rolling of eyes. So what are the non-specific signs we have here? The moderate ocular or cerebral trauma is there. There can be history of poor feeding, vomiting, lethargy, or irritability occurring for days and weeks before the child comes to the hospital in an unconscious state. Please take note of non-specific signs are sometimes attributed to viral illness, feeding dysfunctional or colic, but then this is a cover-up. You have to see through this particular apparent reasons. You have to be very cautious about it. Don't take everything on the face value. The classical presentation is the metaphysical lesion, rib fracture, and CNS injuries. So these three things are very, very diagnostic. Number one is radiological CT scan and MRI will show you triad of subdural hemorrhage, number one. Number two, retinal hemorrhage. Number three, encephalopathy. Triad of head scan will have three things: subdural hematoma, retinal hemorrhage, and encephalopathy. A 50% greater rate of detection of subdural hematoma using MRI compared with CT. CT is not a very good investigation for detecting subdural hematoma. Please remember this. There is a fallacy rate approximately 50% if you go for CT, and if you go for MRI, probably you will be rewarded. So here this is a CT. You can see MRI, T1 weighted MRI, and there is a bilateral fluid collection from chronic subdural hematoma and a new subdural hematoma in the right frontal and posterior fossa. New one is बिल्कुल white नजर आ रहा है, and dark one is on the left side, is on the dark side, which is the older one. So there are two lesions. One is the recent, one is the old. Here you can see the fracture of femur. Right femur is fractured. Here you can see child having undergone, there is multiple posterior rib fractures, where arrows are present. And this is the knee joint where you see the metaphyseal lesion, especially this is a growth plate which has been displaced and fractured here. Classical metaphyseal lesion it is called, and originally termed by Cafe as bucket handle. It occurs in 39 to 50% of abused infants less than 18 months old, and it is a pathognomonic of non-specific injuries belonging to child abuse, physical abuse, shaken baby syndrome. It can present in any major long bone, but most commonly in the tibia, distal femoral, proximal humeri, and usually occurs bilaterally. Here, this particular radiographic examination, as well as a colorful diagrammatic representation, tells us classic metaphyseal lesion. It is affecting the proximal tibial, presenting as bucket handle fracture, showing in the diagram on the left, and in a it is an example of an X-ray image to the right. On the right hand side, we have a diagrammatic representation. The consequences of child abuse are, it is characteristics of child's exposure to abuse or neglect, including timing, chronicity, severity, and type of abuse. And that influences the risk for the problem which are going to be coming in future. The consequences of child abuse needs to be remembered in the light that they result in irreversible changes in the brain function, All aspects of development are affected, including brain, cognition, and social development. Now, what are the consequences which we are going to see in a case who has been child abused in the past and in future, what he is going to face? So these are the behavioral or developmental consequences. Let us go and see. At infancy, you will find permanent brain damage. So because of this permanent brain damage, there is a mental retardation, and mental retardation is also associated with developmental delays. There can be hearing problem, the child can be blind, there can be learning disabilities, child can have certain paralysis, maybe, which are whatever the centers of the brain, motor areas are affected or peripheral nerves are affected because of the fracture. You will find those nerves. Paralysis will be there, and psychiatric problem, emotional problems must be there. If we have injuries at infancy, the child will have nightmares and night terrors. In preschool children, in a school, preschool children means 4 to 5 year of age, you will find the boys, they tend to externalize their emotions. So what they do, they are very aggressive in their behavior. They are bullying to their friends. They show undue anger because they have experienced what they have experienced in early their age. They express that only. And especially girls, they are more likely to internalize their behavior. They will be silent. They will not show their emotions as the boys. These are extrovert creatures and females are introverts. So their behavior pattern is very, very different. What you will see, the girls become depressed and socially withdrawn, present with somatic symptoms like headache, abdominal pain, and they convert their emotional trauma, emotional pain into the somatic symptoms, into the headache, body ache, colic. So this is a kind of a presentation where you do not see any good reason why the child is having headache. He doesn't have the visual problem. He doesn't have the hypertension. He doesn't have anything which contributes headache like sinusitis or anything. So ultimately you have to understand that it is a psychosomatic symptom or it is a conversion symptom. The physical symptoms are there because of the emotional causes. So these are very, very important. Generally, these are seen in females. When the child is in the school, primary school, then you will find the child has very poor performance. Scholastic performance is not there. He is scholastically backward child. He doesn't like going to school. He is not interested in school. There is a poor concentration in class and he has very few friends. He is not very social. And at every given opportunity, he would like to skip the school. He will like to skip the school. And if you see the adolescent child who has suffered child abuse, you will find they have symptoms of depression or anxiety and they have a high risk behavior. हमारे यहाँ के बच्चे कई बार मोटरसाइकिल बहुत तेज चलाते हैं, बड़ी बड़ी छलांगे लगाते हैं. So this high risk behavior is there, and substance abuse, they would like to experiment with the substance. Please note, in one long-term study, 80% of young adults who have history of abuse were diagnosed to have at least one psychiatric disorder by the age of 21. By the age of 21, early onset of psychiatric problem could be a clue that the child has been abused in childhood. So there is one person who is looking after this kind of a child and helping them out. He is Kailash Satyarthi, and he has been recognized for his services. And he says his single aim of his life is that every child is free from the child, free to be a child, free to grow and develop, free to eat, sleep, see daylight, feel to tot and cry, free to laugh and cry, free to play, free to learn, free to go to school, and above all, free to dream. So that is what is the message we have. And with this, we end up this session here, my friends. And I feel that I have taken exceptionally long time. Maybe it is my feeling, but if you have liked this particular session, I feel rewarded for this. And if you have any question answer, we can have those things. So, so friends, Dr. Geeta, Dr. Geeta, unmute. Dr. Geeta, your comments or not been able to listen, unmute yourself. Dr. Geeta, is it not possible to unmute you?
Dr. Chauhan, I can help something?
Surely, we can have an interaction with audience. So we can conclude, or you can also conclude about whatever the question or other, whatever.
I can allow to unmute anyone if wants any mute. Unmute.
Let us see. Dr. V K Gupta
Yes,
is there.
now
Dr. Chinna is there.
anyone who wants to comment or have a question can unmute, and please mute yourself after that. I have allowed to unmute.
Thank you, Dr. Muktinder. Great help you have been.
Thank you, sir.
Thank you.
Just please tell your name first who want to speak. Yeah, one at a time. I think it's Dr. Rao-National who is speaking.
Thank you, sir. It was a great session.
Thank you, sir. Thank you so much.
Myself is Dr. Sheila. Thank you, sir, so much.
Myself, Dr. Sanjeev Agarwal. Thank you very much, sir. बहुत बढ़िया लगा. एक दवा बहुत अच्छी है सर इसमें जो मैंने यूज की है चाइल्ड अब्यूज में.
जी बताएं.
सर कार्सिनोसिन है जो कि बहुत बढ़िया दवाई है. अगर
अरे कार्सिनोसिन क्लासिकल एक ही दवा आती है चाइल्ड अब्यूज में और सेक्सुअल अब्यूज में. बैटर्ड चाइल्ड में
थोड़ा एलैबोरेट कर दीजिए सर.
वो ब्रीफ किसी और करेंगे क्योंकि उसके साथ में मटेरिया मेडिका और रिपर्टरी के भी रुब्रिक लगाएंगे तब पता लगेगा आपको कि किस तरह से आती है. इट इज अ वेरी इंटरेस्टिंग थिंग बट देन यू हैव पिक्ड अप द करेक्ट मेडिसिन which I am very much influenced with this medicine personally speaking.
Thank you, sir.
Yeah, in my experience also, I have experienced Cipia as great child abuse drug.
Good, good, sir, good.
Yes, thyroidinum. I have some cases where the child is generally obedient, but inside is abused. Very much like carcinosin, but carcinosin is diligent, but thyroidinum is not that diligent.
Good,
so if you find a carcinosin like a child who has been abused, but is obedient but non-diligent, because carcinosin is obedient and diligent both. Okay. But if a non-diligent type but obedient with the child abuse history, thyroidinum gets a great work.
Thanks, Dr. Saab. It is a great input that on one particular symptom we can discriminate these two important remedies.
If the child behavior after abuse or after being separated from mother becomes very attractive, and the child is very shining in everything, but chocolate does a great job because the
Right.
behavior is
Soft.
attractive. Yeah,
Soft
but
food
forced
corresponds.
feeling, not loved feeling with great attractive behavior. He is a shiner in every, shining in sports, shining in work, everywhere, but not very diligent in studies. But other extracurricular activities, child is very active. But that sweet child, like that is a chocolate child. It is again a great child abuse remedy in my practice.
Okay, good, sir. That is a very nice expression of chocolate.
सर हाँ सर, सेशन तो बहुत ही अच्छा रहा और काफी टॉपिक
शुक्रिया।
कवर हो।
मैं सोच रहा था कि कुछ ज्यादा ना हो जाए, क्योंकि एक बहुत फास्ट चला हूं मैं, जरा स्लो चलने के बजाय तेज चल दिया था।
नहीं नहीं, ठीक रहा डॉक्टर साहब, वो तो ठीक रहा। और डॉक्टर मुक्तिंदर सर, प्लीज बहुत बहुत थैंक्स आपके लिए।
हाँ नहीं,
आपने
डॉक्टर मुक्तिंदर, यस।
टेक्निकली सारा करके देते हैं और आज आप पूरा हमारे साथ रहे भी, होस्ट बन के, हमें किसी को
नहीं,
परेशानी।
आपने बहुत हमारा ख्याल रखा, इस बात के लिए हम शुक्रगुजार तो हैं ही हैं दिल्ली स्टेट की तरफ से आपके, और आप वैसे भी सभी लोगों का ख्याल रखते हैं, तो जी।
डॉक्टर मुक्तिंदर सर को बहुत थैंक्स, दिल्ली स्टेट ब्रांच की ओर से बहुत बहुत शुक्रिया।
डॉक्टर चौहान, मेरे को खूब आइडिया है, मैं भी किसी दिन लेता हूँ कि डोमिनेटिंग पेरेंट्स के ऊपर ना, जो चिल्ड्रन हैं उनके ऊपर मैंने एक प्रेजेंटेशन बना रखी है।
आप जरूर दीजिए भाई साहब, आप जरूर दीजिए ना किसी वक्त हमारे सेशन में, एक बार शोभा बढ़ाइए हमारी भी।
कार्सिनोसिन, एलुमिना भी जो होता है हेड बिलोंग टू अदर डोमिनेशन के कारण वो बिल्कुल इंडिसिसिव हो जाता है, उसमें भी बड़े अच्छे जो केसेस निकलते हैं। उसके अलावा और मैग्नीशियम चिल्ड्रन है जो डोमिनेट।
ऐसा करें ना, ऐसा करें, हमारे साथ अगर हो सकता है तो प्लान कर लेते हैं एक एक टॉपिक, हम साइकेट्री लेके चल पड़ते हैं, पूरी साइकेट्री कर देंगे हम।
यस यस सर, बहुत अच्छा और बड़ा इंपॉर्टेंट है, हमारी प्रैक्टिस में बहुत काम आने वाले ये जो आपने आज टॉपिक टच किए हैं ना
भाई साहब। यूं करें, आप सप्लीमेंट करें मटेरिया मेडिका को, रिपर्टरी को, मैं टेक्स्ट लेता हूं अपने सेक्रेटरी का।
यस सर, हम कर सकते हैं ऐसा। मैं मटेरियल, बिकॉज मैं पीडियाट्रिक में डील कर रहा हूं लास्ट 20 इयर्स से।
इट विल बी अ ग्रेट कॉम्बिनेशन, इट विल बी अ ग्रेट सप्लीमेंटेशन एंड कॉम्बिनेशन थ्रू ईच अदर। हम एक दूसरे को सप्लीमेंट करते चलते हैं, तो सेक्रेटरी की पूरी रिवीजन कर देते हैं हम। 3 महीने में, 6 महीने में हम लोगों को, या 8 महीने में पढ़ा देंगे सेक्रेटरी।
हम एक कैलेंडर सर, एक कैलेंडर बना लेंगे टॉपिक्स का ना,
तो चलो ठीक है, तो मैं
मैं
आपको कॉल करता हूँ, हम एक बार प्लान आउट कर लेते हैं और फिर हमारे किसी भी सेशन में इसको एक शुरू कर देते हैं। तो अच्छा रहेगा, क्योंकि मुझे लगता है कि हम शायद कुछ कर पाए इस दिशा में।
गुड आइडिया, सबसे बहुत अच्छा आइडिया है।
तो हम प्लान करते हैं सर, सेक्रेटरी पूरी करेंगे।
माय प्लेयर, आपके जैसे सीनियर के साथ काम करके मैं भी कुछ
देखो, हम सब प्रोफेशनल है, हम सब प्रोफेशनल, और अपना अपना एक एरिया है, हमको कुछ चीजें अच्छी लगती है, हम उसमें पढ़ते रहते हैं। अब अच्छी बात है कि हम शेयर करें आपस में, और हमारा टाइम आ गया है शेयर करने का अब।
श्योर सर, श्योर।
और ये ऐसा वक्त है जबकि इट इज ए, चूक गए तो चूक गए शेयर करना, और चूक नहीं गए तो कर दिया। इट विल बी बोथ वे।
नहीं सर, मेरा तो ये जो कोरोना का, हमें कोविड का
ब्लेसिंग इन डिसगाइज, कोरोना इज ब्लेसिंग इन डिसगाइज।
अदरवाइज फिजिकली लोगों का मीट करना और ऐसे जो जुगलबंदी और जैसे ये जो टीम वर्क मुश्किल हो जाता था कि फिजिकली कब मिलेंगे, कब प्लान करेंगे, कब एग्जीक्यूट करेंगे।
नहीं, अब कर देते हैं,
जस्ट अ प्लानिंग अवे।
अभी कर देते हैं, इस हफ्ते में हम लोग फाइनल कर देते हैं कैलेंडर। लेट अस सी। डॉक्टर गीता, आप मॉनिटर कर लो हम लोगों को, कि हम लोग अगर कोई भी गड़बड़ी करें ना, हम लोग भागे इधर उधर, तो हमको ठीक कर देना।
डॉक्टर वी के गुप्ता सर भी हैं मेरे ख्याल, सर आप हैं, सुन रहे हैं?
वी के गुप्ता सर होंगे, जरूर हैं, लेकिन वो इंटरेस्टेड रहते हैं ऑब्जर्व करने में, देखने में, और फिर उनसे हम कमेंट लेते हैं कि हमें जो एक नेशनल लेवल पे जो एक डायरेक्शन है, वो डॉक्टर वी के गुप्ता से हम उम्मीद करते हैं, और हम खुशी भी जाहिर करते हैं कि वो हमें सुनते हैं और हमें बढ़ावा देते हैं। सबसे बड़ी बात यह है। डॉक्टर गुप्ता सर,
मेरे ख्याल वो मैंने रिक्वेस्ट तो भेजी है उनको अनम्यूट करने के लिए, पता नहीं वो।
चलो कोई बात नहीं है, बट देन ही इज विद अस, ही इज विद द प्रोफेशन।
सर उनकी गाइडेंस बहुत ज्यादा है, वो इनकरेज करते हैं, वो अपने आप में एक
हमारे लिए तो,
मोटिवेशन है।
अब हमारे लिए तो ऐसे 2 ही 4 व्यक्ति हैं जिनसे कि हम उम्मीद रखते हैं कि हमारी तरफ देखें, वो हमें कोई गाइडेंस दे, हमें कोई रास्ता दिखाए, हमसे कोई गड़बड़ी हो रही तो ठीक करें।
चलिए सर।
चलिए कुछ क्वेश्चन आंसर हैं तो करके, नहीं तो कंक्लूड करें फिर मीटिंग को।
हाँ, कंक्लूड करते हैं डॉक्टर साहब, एंड वी आर गोइंग टू टॉक टू ईच अदर वेरी सून। मैं आजकल में फोन करता हूँ आपको।
कल सुबह करते हैं बात सर।
ठीक है, थैंक यू सो मच।
Okay, bye. Dr. Geeta, so with this, great thank you and special congratulations to Delhi State team, and I have special thanks for Dr. V K Chauhan and all those participants who were actively participating. So hope to meet next time soon. Thank you all. I'm concluding the meeting now. Yeah.
थैंक यू सर, थैंक यू वेरी मच।
थैंक यू सब अटेंड करने के लिए, सारे डेलीगेट्स को सो मच थैंक यू।